After nearly a decade of planning, Bluewater Health announced today an important step that will move them closer to start construction and renovations on Petrolia's hospital. Several government officials were in attendance in the core room of the Charlotte Eleanor Englehart Hospital. Bluewater says the Ministry of Health has given them the approval to proceed to tender. Health officials say the tender documents are expected to be released by the end of this month, followed by a 90-day tender process with the hopes of awarding a construction project by early spring. This project, which has been in the works since 2016, focuses on modernizing the emergency department and diagnostic imaging units. Sarnia Lambton Member of Provincial Parliament Bob Bailey was in attendance, along with other local government and Bluewater Health officials. Here's what a few of them had to say.
Thanks, Paula. I appreciate it. All the hard work you've done. It's been a real pleasure from my office and my staff to work with Paula and the Bluewater Health staff, all the different, and of course, we liaison with the ministry. Paula never loses heart. I'd say, have you heard anything from the Ministry of Health yet? No, but that's just the way they work down there. And I said, oh, okay. And anyway, so I'm so glad to finally be here today. I'm looking forward that now we can work with Mark and his team, and I know he'll have lots to say about that. And I'm really anxious to hear his formal remarks about the foundation and the big part that they're going to play in this. And I intend to work very closely through my office with Mark and the members of the foundation. Of course, Paula's team. She's not done yet. I'll still be calling Paula.
We also had the opportunity to speak with President and CEO of Bluewater Health, Paula Reaume-Zimmer, about the next steps for this redevelopment project. When you're in the building, you can just see on your own that it needs some upgrades, but what was identified back then as major priorities?
Well, the emergency department, for sure. The emergency department was actually built to have a capacity of approximately 6,000 a year, and then 26 now. So clearly we've outgrown capacity. We need to create the space, modernize space. A lot of equipment's really evolved, and so we want to make sure that we have the most modern equipment. But you need the space, the privacy for patients to be cared for patients to be waiting comfortably as well.